What if I told you that some of the medical tests most seniors are offered are not only unnecessary, but could actually shorten your life? It sounds shocking, doesn't it? We trust hospitals, we trust clinics, and we trust the word routine checkup. But here's the truth. Not every scan or test is meant for everyone, especially not after the age of 70. Every year, millions of older adults are put through procedures that promise safety, but instead create fear, side effects, and sometimes even new health problems. So today, I want to share with you 5 medical checkups seniors over 70 should think twice about. I'll explain why they can be harmful, what alternatives may be safer, and how you can protect yourself, your peace of mind, and your years of life. Number 1, the full-body CT scan. This one sounds impressive. A giant machine, a scan that promises to see through your entire body. To catch cancers before they spread, it is sold as the ultimate tool for prevention. But here's the hidden truth. A single full-body CT scan gives you radiation equal to 500 chest X-rays. That's not a small number. That's a massive dose of radiation. And instead of protecting you, that exposure actually increases your lifetime risk of developing cancer. Now, here's the problem. CT scans don't just find dangerous tumors. They also pick up harmless shadows, little spots that come with age. For a 75-year-old, this is almost guaranteed. But when doctors see these shadows, the chase begins. You may be told you need a biopsy, or more scans, or a hospital stay. And for weeks, maybe months, you live under stress thinking you have cancer. In the end, most of those spots are nothing. But by then, the fear has already taken its toll. A case in point, a man named Harish, age 72, took a full-body scan just to be safe. The scan showed a small spot in his lung. The doctors pushed for a biopsy. The biopsy caused a serious infection. He ended up in the hospital for 3 weeks. And after all that, the spot was completely harmless. Experts now warn, unless you already have symptoms that truly suggest cancer, a full-body CT scan is more dangerous than helpful. Prevention is good, but unnecessary radiation is not. Number 2, brain MRI for memory loss. Memory slips are scary. You forget a name. You misplace your glasses. And instantly the fear of dementia kicks in. That's why many seniors ask for a brain MRI. Here's the problem. Brain MRIs in older adults almost always show something. Tiny white spots, shrunken areas, minor changes that are completely normal with age. But doctors call them abnormalities. Now imagine this. You're 73. You forget where you kept your keys. You get an MRI. The doctor frowns and says, "We found something." Suddenly, you and your family are terrified. What follows? Spinal taps. Medications with heavy side effects. Sometimes even talk of brain surgery. And yet, after all this, your memory isn't better, because most forgetfulness in seniors isn't caused by tumors or hidden brain disease. It's often stress, it's poor sleep, it's vitamin deficiency, it's lack of exercise. A woman named Leela, age 75, went through this exact cycle. Her MRI showed a few white spots. Her family panicked. She was put on strong medicines, but none of it helped. Later, another doctor explained those spots were normal aging. Leela cried with relief, but also regret for the months of fear she endured. A better option? A cognitive screening test. It's simple. It checks memory, focus, and daily functioning. It can point to the real problem without pulling you into a medical maze. Number 3, the cardiac stress test. You've seen this one in movies. Electrodes on the chest, running on a treadmill, doctors watching your heartbeat on a screen. It looks advanced. It feels reassuring. But for seniors over 70, it's often a trap. Why? Because the false positive rate is very high, as much as 40%. That means almost half the people who look sick on this test actually have perfectly healthy hearts. But once the report says abnormal, doctors rarely stop there. The next step is usually an angiogram. That means inserting a tube into your heart arteries. From there, it can lead to stents or even bypass surgery, procedures that are not only expensive, but also dangerous. Take the case of Mr. Suresh, a retired teacher. He felt fine. No chest pain, no breathlessness. But during a checkup, he was advised to take a stress test just in case. The test looked abnormal. He ended up with 2 stents in his arteries. Later, another cardiologist reviewed his case and said, the stents were unnecessary. Mr. Suresh went through surgery, risk, and huge costs, all for nothing. Unless you have classic symptoms, chest pain, shortness of breath, fainting, a stress test is not recommended. Instead, doctors suggest focusing on blood pressure, cholesterol levels, daily walking, and diet. These reveal far more about your heart's future than a treadmill test ever will. Number 4, colonoscopy. For decades, this has been the gold standard in cancer prevention. Doctors say one test, and we can save your life. And yes, colonoscopies can catch cancer early. But after 70, the balance between risk and reward shifts. First, the preparation itself is hard. You must drink strong laxatives that completely empty your stomach and intestines. For seniors, this can cause severe dehydration. It can strain the kidneys, and it can even send fragile patients to the hospital. Second, the sedation used during the procedure can have surprising effects. Many older adults feel confused for days after. Some experience memory decline. For a 78-year-old, that's not a small side effect. And third, the procedure itself carries risks: bleeding, perforation of the intestine, complications that grow more common with age. That doesn't mean colon cancer screening should stop altogether. Safer alternatives exist. One is the FIT stool test, a simple test you can do at home. No hospital, no sedation, and it's very accurate at catching warning signs. A 74-year-old man named Ram switched to stool testing after hearing about colonoscopy risks. His FIT test detected blood in the stool. Further checks confirmed an early-stage problem that was treated successfully. No colonoscopy needed, no extra risks taken. The lesson? After 70, choose the smarter, safer path. Number 5, bone density scan. At first glance, this one looks harmless. A quick scan, no pain, no needles. But the danger lies in what happens after. Almost every scan of a 70-year-old shows weaker bones. That's natural. But once doctors label it osteoporosis, fear takes over. And the usual solution? Strong medications. These medications come with harsh side effects. They can damage the stomach. They can cause chronic pain. And in rare cases, they can even rot the jawbone. Now think about it. Was the scan really helpful? Or did it push you into unnecessary treatment? Here's the good news. Bone health is more influenced by lifestyle than by pills. Walking every day, climbing stairs, light strength exercises, vitamin D from sunlight, calcium-rich foods like milk, curd, and leafy greens. All of these protect your bones better than most medicines. A 76-year-old woman named Anita chose this path. Her scan showed thinning bones, but she refused heavy drugs. Instead, she walked daily, ate healthy, and practiced yoga. 10 years later, she is still strong, active, and medicine-free. Closing, so there you have it. 5 tests that sound helpful, but may quietly steal your peace, your health, and even your years of life. The full-body CT scan, the brain MRI for memory loss, the cardiac stress test, the colonoscopy, and the bone density scan. Each of them can be useful in the right situation. But for most people over 70, the risks often outweigh the benefits. Before saying yes to any test, ask your doctor this one simple question. If this finds something, what happens next? If the answer doesn't truly protect your future, it may not be worth it. Remember, real health is not about chasing every scan. It's about living wisely, protecting your body, protecting your mind, and protecting your spirit. Sometimes the best medicine is saying no.